little bit lower. This is not a great place to inject with this gunshot technique, okay? Because the bone there is a little bit thinner, you haven't got a strong bony platform, and there is more risk of the actual product traversing behind the zygoma, and you're losing some of the product into the lower part of the face. We want it to stay in the upper part of the face. So how do we do that? We do that then with a cannula in the subcutaneous layer. I would place the cannula entry point just here, and I would fan just in the immediate subcutaneous layer. But of course now I would use a much lighter product because we're in a different layer. Okay, so we're using something that is a small size product with 2 degrees of cross-linking. Okay, so that's how I would overcome that particular challenge. But she was a good case for this gunshot technique. Okay, back 1 centimeter down, deep into the onto the bone there. Okay, and marking the zygoma because we don't want anything to come below that. Is that okay? And then we'll just turn it to the side. Sorry? The cannula point would be just where you wouldn't put it, where I saw someone put it just the other day, is down here somewhere. Because then you are having to go over the zygomatic arch and then try and access the correct plane. This is not going to be possible with a straight cannula, okay? So you would put it on the height of the zygomatic bone, okay? So that all the plane of the cannula is you're going to be able to maintain the subcutaneous plane. Don't put it down here. It's got to be up here somewhere, okay? And then you measure the length of the cannula you're using, whether it's a 30 millimeter or 50 millimeter. Make sure you can access right up to this point so you can give a good, nice coverage, okay? Fantastic.
27?
This needle, I used the needle in the pack, which was a 27 gauge, correct.
Okay, to the vein.
Right down onto the bone, yes. It's a 13 millimeter needle. If the temporal hollow is very deep, you may need something a little bit longer in terms of the length of the needle. Okay? Excellent, good. Between the tip of her nose, the top lip, bottom lip, and the chin is a little bit like this because of her overbite. So we're going to give her a single point injection technique, and we're going to use Resylane, Perlane to do that. Okay? Just is that okay? Yes, please. Yeah, so we're going to use Resylane Perlane, or what is known also as Resylane Lift now. Okay, pop your head back. Okay, and we mark the midline, or think about where the midline is going to be. And I want to give her not only projection, but as I said, because of the balance and the harmony of her face, I actually want to give her a little bit of elongation as well. So there's a number of ways you can do. If you are just elongating, you inject from behind the muscle onto the bone to give her some projection in this plane. If I wanted to give her AP projection, it would be deep here, but she actually needs a little bit of both. So I'm going to go in between the 2 points at an angle and bring her out this way, and then you'll be able to see very clearly what we're able to do. The product is Resylane Lift or Perlane. Tanya?
Tanya?
Yes. Little translation. Okay, so yeah, okay, nice and relaxed. So we're just feeling where the tip is here, okay? Cautious and conservative at the moment, but I'm sure over the next year or so we'll have a better understanding of how much to inject, where to inject, particularly under the eye. But I know a lot of my colleagues are using the Vital Light, the 12 milligrams per mil HA. But if it's only 12 milligrams, you think, oh well, how long is it going to last? How much longevity are we going to get? Yeah. So we're not quite sure. So for that reason, as I said, I'm very conservative. I only use what's tried and tested, and we know how it's going to behave. Because then I can be very honest with my patient. I can be honest, and then they come back. Yeah. Yeah. Good. You're done. Okay. Do for her. I'm actually going to open this angle up. Okay. So this is a softer tissue. I want to use a product which is a little bit softer, which, no, just with a needle. And I want to just open up that little angle. But don't forget, this is an area that is moving. She expresses herself a lot like this. So I want to use a softer gel that integrates into the tissues to open up the angle there. Okay?
Okay. هلا بده يعوز جل أسلس وبينتشر بطريقة أكثر هون بهالطريقة لأنه ما بدنا شيء جنب. اوكي. بده يحطها هون. لا.
Sorry?
The angle of the mouth oral to measure or where?
No.
For what? For this
The
next
define,
injection?
yeah.
Yeah, where?
Oh no, I'm going to show you that now. Okay. So
Where is it? They are asking you what is this point that you are injecting? What's the name?
Well, now it's going to be in the mental crease.
Okay.
The mental crease, just lateral to the mental crease, okay, for this one, okay? So I'm using Resylane Define. This is a slightly softer gel. Can I have it on a 29 gauge needle, please? Thanks very much. That's okay. These 29 gauge needles that come with the Resylane, I use this for practically everything, to be honest, even the firmest gel to the softest gel. Because although this is only 29 gauge, which is very comfortable for your patient, it has an ultra thin wall, which means inside it is 27 gauge, which allows the flow of product very nicely. It doesn't look unnatural.
Do you like Botox for this?
I'm not allowed to say, but yes, because you appreciate that's not a licensed indication for toxin. But certainly we can talk about that afterwards. Okay, good. So we can just wipe that down. You can probably do that off stage, and then we can see our next one.
Do you think she needs 0.3 under eyes?
So, interesting. I did look at her eyes and think that maybe just a little bit of, yeah. But you can see her face. She's never been injected before. She did not come as a model, okay? We just recruited her in the tea break. So I think for today, it's okay. But yes, but a little bit under her teardrop, she's got a little bit under there, it's fine. And I would use just Resylane Refine, okay? Yes, the Emabel Classic, okay? Because notice, look, please smile, smile, lift, really big smile, really big. You see how she gets a little bit, she has a little bit, not quite a bag, but a little teardrop, but also a little bit of swelling there. If you inject a product that's too firm when she smiles, like this gentleman was saying, then you will be able to see it. You'll be able to see the product, okay? So, and if you do inject, it'll be literally it won't even be 0.1. Sometimes I inject, the Nasha syringes still are overfilled a little bit, so that it's past 1 mil, and sometimes I finish a teardrop and we haven't even got to the 1 mil of the injection.
Refine is more better than imposter?
Yep, go for it.